I think the majority of people suffering from a traumatic impact to the upper body and head have both. I honestly think that it's a matter of definition and perception. What you believe or perceive a concussion is, or what society has come to believe or perceive a concussion is, and then the other point of discussion, my belief or perception for me, is what else is very often occurring at the same time. The substantial forces exerted on the upper neck don't get as much attention as they should, if any attention at all, in the majority of cases. The unfortunate thing is that the neck, specifically the upper neck, is not assessed in the majority of cases where people are having chronic pain syndromes, concussion-like symptoms, or chronic dysfunction, and they really don't know what's wrong with them. They can spend months to years resting away from work, school, or sport and still have no improvement in their concussion-like symptoms. They could spend thousands of dollars to consult with doctors and medical specialists who tell them to get their brain assessed with MRI or CT scans. Subsequently, only to find there is no conclusive evidence of there being something wrong inside their head, which leaves the person feeling hopeless and depressed, and they may never get better. Their life becomes overwhelming. They feel utter dysfunction and symptoms, and yet the experts tell them that based on imaging, they should be fine, but they don't feel fine inside. Pay very close attention to these next remarks, because I believe that the secret lies here within. Based on the recent brain injury research as depicted in the movie Concussion that has been done on chronic traumatic encephalopathy, or CTE, I don't think the majority of concussed people want to wait till they're dead for their family to find out what's going on inside their head, if the upper neck could possibly yield some answers. I believe there's a way of figuring out that they are susceptible to getting CTE before that point is reached, where they are deceased, possibly even from being brought to a point of taking their own life, and CTE is found on autopsy. The way to do this would be to start with a thorough assessment of the upper neck. We must assess them not only in functional X-ray imaging, where the individual moves their neck and head while under the X-rays, but also assess them via an upright positional MRI. I'd also like to see everyone get an actual measurement of the pressure, speed, and volume of cerebrospinal fluid circulating through the brainstem and spinal canal in the neck. We want to know how much pressure is inside there, how much fluid is flowing through it, where it is being restricted, where the pressure is too high, and where the pressure is too low. This is important to assess so that proper measures can be taken to try to address all the problem areas where there is a restriction of cerebrospinal fluid flow due to, for example, a bulging disc or shifted bones to damaged ligaments, and where the spine is unstable or too mobile at certain neurological levels. Unfortunately, cerebrospinal fluid flow measurement is a complicated process, and there are only a couple of private clinics in North America that can measure this. The wait times are long, and if you don't get an appointment, then you will have to travel to New York or some other major city. Once we have a good understanding of these factors, then we can begin addressing those identified problems in a sequence of least invasive treatments to most invasive, to see which treatment potentially gives the best results of a longer lasting reduction in pain, dysfunction, and symptoms. As far as my own personal life experience with these types of injuries, and what I gravitate towards with the majority of my patients that have these types of injuries to the ligaments in the upper neck, is to do trigger point treatments, which is also known as acupressure or sustained pressure on certain muscles in the upper neck region. I would target the particular muscles that would be expected to be overly active, always found at the exact spots on motion X-ray where the ligaments have been compromised. So you first need to determine by functional imaging, motion X-ray, and upright positional MRI, which ligaments are supposedly compromised, whether torn or overly stretched, it doesn't really matter because they both result in too much motion in the bones. Therefore, the tiny core muscles at the spots of ligament damage would then be required to take over the job of stabilizing that area and attempting to make this damaged area more stable, with the sole intent being to protect the nervous system housed within those bones, whether it be the brainstem or spinal cord. Note, these tiny core muscles are involuntary and respond exclusively to stretch signals, and so when ligaments are damaged and bones shift excessively, these tiny core muscles repeatedly get stretched, resulting in their repeated involuntary contraction to take that stretch. This process occurs non-stop from the moment the ligament damage occurs and is their new way of functioning. It is therefore logical that these core muscles would quickly become overutilized and would fry out faster, almost like a long-distance runner's calves cramping while running a marathon. The major difference being that a runner can decide to stop running and rest when they feel the cramp coming on, whereas the tiny core muscles have no choice to stop. When this occurs, the muscles would then seize up, trying to protect themselves while still protecting the brainstem and spinal cord from irritation due to excess shift in the neck bones from the overly stretched ligaments. When this happens, and these muscles seize and go into lockdown mode, they often shift the same bones in the opposite direction, which again puts pressure on the brainstem or spinal cord, which subsequently results in the concussive-like symptoms. They also now develop what are known as trigger points, which are painful and refer pain to other locations. For example, a tiny core muscle under the back of the skull, connecting the top neck bone to the skull, causing a headache in the forehead and behind the eyes. The acupressure or sustained pressure technique on those muscles mechanically forces the fibers to release, and at the same time, when held long enough, squeezes out any accumulated chemical toxins, lactic acid being the most prevalent, from these tiny supporting and overworked muscles. The long, sustained pressure does not allow the lactic acid to seep back into the tiny muscles and allows our lymphatic system, which is a slow-moving, waste-filtering system in the area, to basically come and scavenge all those pain-generating chemicals and flush them away so that the muscle can be replenished back to their more functional state. After a minimum of 20 seconds, even longer is better, of sustained pressure on each overworked muscle trigger point, that muscle spot releases from its rigid form and your body naturally fills that group of muscle fibers that have just been squished empty of the lactic acid with fresh blood. This fresh blood is full of nutrients, full of oxygen, and triggers a reset button among the group of muscle fibers so they can return to functioning more normally again and release from that lockdown mode. Once you have released that first spot of tension, you can then continue using sustained pressure and work your way through the entire muscle, or as many sore spots on the muscle as you can find, called trigger points. To release these trigger points manually, hold them long enough so that you can deplete the pain-generating chemicals and lactic acid that has accumulated in the muscle, typically anywhere from 20 to 60 seconds, or more if needed, and to your maximum pressure pain tolerance. For myself, and also with the thousands of patients that I work with, applying this technique to my neck has provided dramatic relief and a considerable return to normal function, because I believe it neutralizes the positioning of the neck bones and renews the ability of those tiny and involuntary muscles to then react more normally every time a bone starts to go out of position. And it quickly pulls the misalignment back into the correct position. Ultimately, the problem is that the damage to the ligaments, which results in the potential for these neck bones to on occasion go out of position and put pressure on the brainstem or restrict normal CSF flow. It can and does happen to some of my patients and myself too, and this means you could begin re-experiencing concussion-like symptoms for no apparent reason, even without hitting your head again. Unfortunately, this is something that some people with very damaged ligaments will have to live with for the rest of their life. However, learning how to implement the sustained pressure technique is, in my opinion, the best solution to reset those tiny core stabilizer muscles in the neck and return them to a better state of function quickly and without waiting for an appointment with your doctor. Knowing how to combat this pain with sustained pressure by resetting those muscles will help them function normally for a period of time. Depending on the individual and their specific case, the relief from pain and dysfunction can sometimes be a day 2 days or perhaps a few weeks where they're feeling more normal again, and they can better multitask, and they are not as irritable at work or with their family. When a patient uses the sustained pressure techniques I teach them, they often will report fewer headaches, less pain, less pressure, less hot flashes, fewer heart palpitations, less blurry vision, better concentration and mind clarity, less irritation and anger, etc. It all literally goes away with sustained pressure on the right muscles. However, the pain and symptoms will slowly start to trickle back over time. It can sometimes come back faster than other times, and sometimes you will go weeks without troubles. There are a lot of factors that can influence the speed of which the neck muscles get overworked again, such as sitting at a computer desk for too long or looking down at your phone too much. The most important thing to realize and accept over time is that the symptoms will return, but that there is a temporary solution that does work and does not require any outside treatment from any medical professional or medication. The moment I came to this realization for my own personal permanent injury problem is the moment that I got my life back. The next most important component was to have direct family and friends understand the same. But because they do not live with these issues, it is much harder for them to comprehend. Sometimes, with a very small group of people, their initial ability to withstand the treatment is not so good. This is due to one of a few possible reasons. One, their tolerance to pain is low and they do not allow for enough depth of pressure, but find that if they truly understand the underlying mechanism, they can prepare their mind for tolerating the treatment pain better. Number two, their strong preconceived notion that it is their brain that is injured, and therefore the acceptance of what I explain as wrong is diluted by their years of hearing concussion. Number three, they have been labeled with diagnoses such as POTS, dysautonomia, ME, etc., and find it very hard to believe that the answer I'm giving them could be so simple and not come with a name that they cannot pronounce. Number four, they have been indoctrinated to believe that the treatments should be painless and involve medication or supplementation. Number five, they have been indoctrinated to believe that their issues are due to abnormal and weak muscles instead of normal muscles that are doing exactly what they're supposed to do and are overworked as explained above. Again, for them it seems too simple. And number six, other reasons, but the above are by far the most common, and nearly all reasons boil down to the answer and solution not being complicated enough. Again, mainly based on belief and perception. To summarize, the protocol for me when dealing with these types of cases and from the standpoint that I just discussed is number one, I start by assessing the neck and neck ligaments for damage. Number two, if there's damage, then pinpointing exactly where that damage to the ligaments is located. Number three, this will then guide me to which muscles would be expected to be overly active and prone to being overworked, resulting in them going into a lockdown state. Number four, we then get to the work on treating those areas using the sustained pressure technique. It is really quite simple to provide relief if you know the background of what's going on inside the neck. In general, the results are much better when the treatment is initially done on patients passively by me. This is because I know exactly where and how to push, and as long as they can tolerate the treatment, they will see the results and be much more apt to want to try it on themselves. It is very important to know that the treatment must increase the baseline symptoms during the sustained pressure, so that when the sustained pressure is removed, that the baseline symptoms are less. For example, if the main baseline symptom is debilitating headache in the forehead and behind the eyes, that during the pressure, the headache increases to an almost intolerable level, so that when the pressure is then removed, the baseline headache will be less.